Dave's here, we can start.
Start now.
Good morning, welcome to our Minnehaha Commission meeting for November 19th, 2024. I'm going to call our meeting to order. And note for the record, we do have a quorum of commissioners. Commissioner Bender is absent today. Just please silence your cell phones, and if you're going to be speaking at any public comment, we request your name in the back of the room in that book for the record. Please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. All right. Into our routine business, I'd look for a motion to approve our agenda.
So moved.
Second.
All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Consent agenda is our bills to be paid, personnel actions, kind of our routine stuff, I guess. Anybody from the public like to pull anything from the consent agenda? Not anybody from the public like to comment on a consent agenda? Anybody from the commission want to pull anything from the consent agenda? Look for a motion to approve our consent agenda.
So move. Second.
Please call the roll.
Bemiga,
Aye.
Kipley,
Aye.
Blindberg,
Aye.
Karski.
Aye. Motion carries. Moving into our regular business, our first item is the Lifescape Foundation presentation, and we have Jessica Wells, the foundation president, here this morning. Good morning.
Good morning. Thank you. Jessica Wells, president of the Lifescape Foundation, representing Lifescape organization as a whole. Thank you for having us today, and thank you for serving as commissioners. All right. Quick overview of Lifescape as a whole. We support individuals from birth through end of life. We have 38, soon to open our 39th adult residential home, over 433 adults, primarily from Minnehaha, Lincoln County, Southeast South Dakota. There are other 19 other community support providers in our state. So Dakota Abilities is another in our community. Similar to that, we have children's services. We've got over 4,500 children that we support from across the state and pull from a little bit wider region. We are the state's only 18-bed specialty rehab hospital for pediatrics. We also have 60 children that live in our residential facility here in Sioux Falls. I'll talk a little bit more about that a little bit later in the presentation on how that's not enough beds. We do have wait lists. And then we have another group of students that just come in for day school. So we have a school program as well. In our adult services, we do residential care. We also have supported employment, so that helps some of our employment in the state as well. And then we also have 3 outpatient centers, 2 here in Sioux Falls, Autism Child and Development Center, ACDC, over on Sartoma and 41st Street. That's predominantly for children with autism and related disorders. And then we have an outpatient center on 18th and Grange. We've also got oversight. We have 13 service lines that are oversight by the Department of Education, Department of Health, Department of Social Services, and Department of Education and Human Services. Lots of oversight in our services. We have one for-profit arm of our organization called Rise Custom Solutions. This we do orthotics, prosthetics, assistive technology, wheelchair adjustments, lots of adapted technology as well in that area. In this, we support children and adults in that service line. We are one of the top 13 size-wise employers in Sioux Falls with 1,100 employees when we're fully staffed, and 60% of those employees are direct support professionals. So they help individuals with their daily living. Our annual budget is an $88 million budget. We are predominantly funded through Medicaid, 74%. Private pay is 13%, and commercial insurance is about 13%. We are one of the only providers, we are the only provider that supports children with autism services that need that applied behavior analysis treatment that accept Medicaid patients. There are other providers across our state, but they do not accept Medicaid. So we are one there. The Lifescape Foundation helps support the organization through an annual disbursement of about $2.7 million that goes into operations when needed. We also help with rent and food assistance for adults. The support that the county gives Lifescape also helps individuals in their basic needs. We have most of our about 90% of our adults that we support are below the national poverty level. So that assistance is definitely needed. It helps make their lives be able to live in decent housing. I'll show you a little more what we're doing to address that area. The foundation also helps with specialized equipment. We help pay some medical bills if individuals, dental is one that not great coverage for folks. Then we also support the organization in purchasing land for our adult residential homes that we are on a plan to keep constructing. And then, of course, we help with staff recruitment and retention, which is a huge piece of our organization. We have South Dakota's only 18-bed specialty hospital for pediatrics. This allows children to get their care closer to home. If they have an accident or a surgery, if we are not able to support them, then they are sent to Omaha, Denver, far away from their families. So our hospital allows them to stay close to their families and continue that rehab and relearning how to walk or button their shirt or feed themselves. We also have, we support school districts. If a child they're unable to meet their needs in their school district, they will contract with Lifescape to support that child, either in day services for school or residential care. Typically, by the time schools are not able to meet their need, families at home have already been struggling for quite a while, predominantly in the challenging behaviors or complex medical needs. If children are not supported by Lifescape in our specialty school or our specialty hospital or residential care, they will most likely have to be sent out of state. So we've got some individuals who we're working with the state right now that are aging out of our children's services, which they can stay in until they're 21 based on education laws. Once they turn 21, their next option, if they have complex medical needs, most of the children and young adults we support have over 3 to some children have over 100 diagnoses. So very complex cases. They will be sent out of state. Nursing homes don't typically like to take 21-year-olds, 22-year-olds, not a great fitted space for them. And so that, unfortunately, that is the option right now. We're trying to work on some plans to help get them the care that they need and stay closer to their families. We also partner with a lot of our higher ed. Workforce development is important to all of us, so we do a lot of internships. We have partnerships with over 60 universities and colleges nationwide that allow their students to come in and do clinical rotations. They do internships, they do work shadowing, just to try and really keep them home, keep them in South Dakota if we can. We have a partnership with the University of South Dakota for board certified behavior analysts. That's psychology services. That autism treatment is one area that is a shortage of staff across our nation. And we are trying to encourage kids to get that added. They could become a teacher and make $70,000 a year or $50,000 a year. Sorry, I'm married to a teacher, should know that number. And they could get that board certified behavior analyst and add $30,000, $40,000 onto their annual salary and provide a much needed service to children in our state. Our adult services, I talked about this a little. We've got a day service program that individuals that may live with their families come in and just spend the day with us. We have others that are able, 143 families, take advantage of our Family Support 360, which allows some supports within the home so they can still continue to live with their families and just receive the levels of care that they need in specific areas. The demand keeps growing. Currently, we have over 450 children on our autism wait list. That's for treatments and evaluations. We do support the surrounding states, you can see on the map, and then we also support children in 64 of South Dakota's counties. That demand keeps going up. This graph, as the Sioux Falls population continues to grow as employees move into the state, into the city, their children, if they need services and they can't get them here, they may not relocate here. So that's one thing we want to continue moving children off of that wait list and build that capacity. 1 in 44 children are born with autism right now. We have some of employs 4 of 5 seating and mobility specialists, individuals with wheelchairs getting that those adjustments that they need in their wheelchairs. We also do several intensive therapy programs that are day services for feeding and swallowing disorders with traumatic brain injury are 2 of our largest programs that we continue to grow. One of our commitments is to adults to live in homes that with dignity and respect, and that means living in homes that they're proud to be in. We had a commitment to open 5 new homes in 5 years. We have just completed the 5th one, Washington, up by Washington High School, and that we are going to continue on with. We have at least 2 more in the plans. We've been working with the South Dakota Housing Development Authority on funding for those, and it's brought over $6 million into housing for individuals. 8 individuals can live in each house, and supporting staff have space as well. New development we've been working on actually quietly for the last 6 years, but been making great progress in this last year, is our new children's campus. Our facility on 26th Street broke ground in 1948. The building is old and tired, and we have met our capacity on being able to support the children. So in April this last year, we broke ground on a new about 200,000 square foot children's facility. So you can see our groundbreaking from 1948 and our groundbreaking with children that we support here this last spring. The facility is located up on Career Avenue, along with Tickman is on the north side and 34th is on the south, up north of Southeast Tech. There's 10 acres up there. It is a $98.3 million project. The price tag keeps going up, so we thought we need to put a shovel in the ground to kind of stake that price on there, at least in phase 1. It will have the 2-story residential, the school, the hospital, some administration. One amazing thing about this playground is this facility is the playground. It will be completely enclosed in building so that there are no fences, and the kids can freely play and stay safe in that space. We don't have to worry about them climbing fences and eloping out into the community. And without their staff with them, it will be a great space for children. And then it also has the school as well. We'll be able to increase the residential capacity by 12 children, which will absorb the rest of our wait list in that area. The school will also increase by 25% to accommodate wait lists of day school students. And then we had a donor approach us and asked if he gave us $5 million, would we jump right into phase 2. Phase 2 is the pool, the gym, therapy pool, an outdoor courtyard area, and a clinic room. And of course, we said yes. We were very close to finishing phase 1 funding, so we started with phase 2. The total price of the building is $98.3 million. We've got $95 million raised. That includes $14 million from the state, $10 million from LifeScape, and then the rest from donors and individuals predominantly in our community in eastern South Dakota. You can see the building started, the steel construction is going up, some of the cement walls are also going up. So exciting time if you want to drive by and see that. We're excited that its completion date is estimated for fall of 2026. Thank you. Any questions?
All right. Any public comment on this agenda item? Commissioners, questions, comments? Commissioner Benega?
I'll just make a comment. You guys are a fabulous organization. I've been in that facility multiple times, and what you do for the whole region is incredible. And if you don't walk through and have some emotional contact, you're probably in need of some help personally. So thank you for all you do.
Yes, and I invite you all to come visit if you would like a tour. We're always open to that. Thank you.
Mr. Chair, could I ask, I might have missed this. What's the timeline? You broke ground, but what's the timeline for this new facility out on the northwest side?
Fall of 2026.
Fall of 2026. Outstanding. We'll be looking forward to it.
Yes.
Thank you.
Thank you.
Thank you, Jessica, and the hundreds of direct support professionals, I mean, that you employ, but I know that are employed in our community. It's a mission, it's a calling, and it's amazing that we have the people that do what they can do. very much grateful for what they are able to perform.
Yes, thank you.
All right. Moving on, consider a motion to declare JDC vehicle as surplus and authorize disposal through online auction. Are we doing this in two again, or is this a one action? Two? Okay. So it'll be two actions. Okay.
Good morning, Jamie Gravitt, Juvenile Detention Center. We have a 2010 GMC Yukon that has over 200,000 miles on it, and now we're being told it needs a rear main seal. So we're asking for permission to surplus the vehicle and then sell it through online auction with Purple Wave.
Okay. Public comment on this agenda item. Commission, turn it over to you. First thing we would do is declare it surplus.
That's my motion.
Second.
Motion and a second. Call the roll.
Kipley,
Aye.
Benega,
Aye.
Blindberg.
Aye.
Karski.
Aye, motion carries. Now a motion to authorize disposal through online auction.
So moved.
Second.
Call the roll.
Kipley,
Aye.
Blindberg.
Aye.
Benega,
Aye.
Karski.
Aye, motion carries.
Thank you.
Thank you, Jamie. Consider a motion to declare emergency managed items as surplus and authorize disposal through online auction. Good morning, Jason.
Good morning, Jason Gearman, Minnehaha County Emergency Management. I've got 3 items I'd like to declare for surplus to auction. It's a couple snowmobiles and a trailer. The trailer was donated back some time ago to the rescue squad, and I know one of the snowmobiles was. The other snowmobile, the Polaris Wide Track, was purchased through the county budget. We just haven't used them, and we know we have a tracked Polaris Ranger with a cab, and to throw somebody on a snowmobile that's not trained is kind of a big ask. I have 3 of them myself I'd like to get rid of personally. But yeah, it's something that I'd like to get rid of, and then hopefully we can use those proceeds, if you approve, to help buy the rescue squad, to assist in purchasing the rescue squad some protective gear for their call-outs.
All right, public comment on this agenda item. Questions from Jason, not Jamie. Commissioner Benega.
Jason, I know you're always looking for volunteers. Kind of where are you at with that process right now? Do you have special needs that you're looking for?
Well, right now, we're going through actually a police reserve class. We're narrowing that down, and Maria's kind of spearheaded that to get that class going. And hopefully, if we can have more than 8 people in that class, we'll continue with it. It's 6 or 8, I can't remember the number. And then we can, add to that. But I think we have about 40 police reserves. If you look back maybe 15 years ago, there was probably 60. So it's declined a little bit, but it's manageable. Rescue squad, I've got about 16 to 20, depending on who's there and who's not. And then we are actually actively looking for dive team members, which is unusual. Usually I have a waiting list for the dive team, and now I don't. So we're really looking to push that coming up as for dive team members.
Other questions? Look for a motion to declare the items as surplus.
So move.
Second.
Motion is second. Call the roll.
Benega,
Aye.
Kipley,
Aye.
Blindberg.
Aye.
Karski.
Aye, motion carries. Now a motion to authorize disposal through online auction.
That is my motion.
Second.
Call the roll.
Blindberg.
Aye.
Kipley,
Aye.
Benega,
Aye.
Karski.
Aye, motion carries. Thank you, Jason.
Thanks.
Special commission action to appoint Jacob Morris as interim highway superintendent and approve temporary additional duty pay. Carrie Deaver. Good morning, Carrie.
Good morning, Carrie Deaver from Human Resources. I'm before you today to talk to you about a leadership transition in the Highway Department. Steve Groen, who's been our superintendent for several years, is moving on to the city of Topeka, Kansas, where he's going to serve as the Public Works Director. His last day is Thursday, which means that position is vacant on Friday. So we're before you today asking for your approval to put Jacob Morris in that role on an interim basis and to make that temporary duty adjustment in his salary. Both Jacob and Steve are here this morning in case you have any questions for them.
Okay, public comment on this agenda item. Commission, turn it over to you for questions, action. Bring Jacob up, grill him a little bit, whatever you want to do.
I don't have any questions, but anytime he comes with a sport coat or a suit and a tie, I think we need to put him on camera.
Appreciate that, Commissioner Benega. Thank you for this opportunity to help serve the county. Towards the year end here, we're going to work on closing out construction projects, coming up with what our carryover is probably going to be for next year for uncompleted outstanding projects, and working on getting the rest of our money from the state for big grants that we receive for building bridges. If you guys got questions, feel free to reach out, call, email, stop by the highway department. Thank you.
All right, thank you, Jacob. Commissioner?
Mr. Chair, I'll just say, got some big shoes to fill. I think Steve has taken our highway department to the new next level, so appreciate his service and got a great facility out there. So I think you're just set up for success here. So I'm optimistic about the future of the highway department. So we appreciate you stepping up into this interim role and hope we'll see you as a strong leader into the future. So thank you.
I would echo your comments. Steve has done a fantastic job transitioning into a new facility. We have a great place, I think, to work, and we've got great employees out there with, morale is high, and I'm just excited to keep that ongoing. So congratulations, Jacob, I think. I'll look for a motion to approve this action.
So move.
Second.
Any other additional comments?
Yeah, I would also like to thank Steve. I made some comments last night at the township meeting, which was well attended. Steve, you've done an awesome job with reorganization and certainly completing the highway department building. It was a process, and the grants that you were able to obtain over the last few years is admirable. So thank you for making a positive influence on that particular department.
Commissioner?
Thank you. I think my fellow commissioners hit all the points that I was hoping to make also, so I would just like to extend a thank you to Steve and best wishes.
We have a motion, or yeah, okay. Call the roll.
Benega.
Aye.
Blindberg.
Aye.
Kipley.
Aye.
Karski.
Aye, motion carries. Thank you, Steve, and thank you, Jacob. All right, consider a motion to approve the 2025 liquor and wine license renewal applications. We have a bunch of them.
Good morning, Commissioners. Kim Christensen with the Auditor's Office. We have received the 2025 liquor and wine license renewal applications from the license holders outside of the municipalities within the counties. There were no objections or concerns reported by the state's attorney and the sheriff's office regarding the applications. There was a concern raised by the planning department regarding the alibi related to the operation of the establishment, since the application stated they were closed for remodeling. Should also be noted that all of these licenses before you today did pass the last compliance check and stuff. The renewal fees kind of range for $500 for the wine and cider, $500 for the package off sale, and the full liquor retail license will range between $900 and $1,500 depending on the location to the nearest municipality. So if you're near Sioux Falls, you're paying the higher end of the scale. And all of these fees do stay with the county.
All right, public comment on this agenda item. Any questions for Kim?
Yes, Mr. Chair, did you say planning wants us to take some other action on alibi?
I'm gonna
or
ask
is
Eric
it
to
a
kinda help me
substantive
with
concern, or
that.
is it just a note that they're remodeling? I mean, business has the right to remodel. I mean, I don't know that would stop us from approving this, but.
There you go. Mr. Chair, remodeling is one thing. It apparently has been closed for some time, inactive. Generally, like we do on the cannabis license, there's a requirement the license actually be active.
Sure.
So it's not just being purchased and held. Alibi has, in essence, moved its operation across the highway into the city limits of Sioux Falls. So this is an unknown status right now. I wish planning was here to address their own concerns. At one point, I was led to believe that there was actually been some demolition done out there, but apparently that's not true. So it may be prudent to hold this one until a future meeting where planning can be present to address some of their own concerns.
So no open permits or anything that we're aware of?
Yeah, again, I wouldn't want to answer for the other department, but.
Okay.
I would make a motion to approve all the applications except for the alibi, and we readdress that to next week.
Okay.
I'd second that motion.
Motion a second. Further discussion? You want to call the roll from there?
Yeah, I can.
Okay.
Benega,
Aye.
Kipley,
Aye.
Blindberg.
Aye.
Karski.
Aye. Motion carries. All right. Authorize the chair to sign the 2025 Rural Ambulance Services Quality Assurance Director Agreement. Morning, Meredith.
Morning, Commissioners. Meredith Jarko, County Commission Office. So before you today is the contract renewal of the Quality Assurance Director. Dr. Jeff Luther serves as the Director for the Rural Ambulance Services. So the contract would run from January to December for 2025. The proposed contract is $33,000, which is payable in 12-month equal installments. Just as a quick note, that contract increased from $30,000 to $33,000 starting in 2023. So this would be the third year of that amount.
So next year it's negotiable or
Potentially.
renegotiated. Okay, public comment on this agenda item. Commissioners, questions? Action.
Make a motion to approve?
Second.
Motion a second. Call the roll.
Blindberg,
Aye.
Kipley,
Aye.
Benega,
Aye.
Karski.
Aye, motion carries.
Thank
You, Meredith. All right, we are at the end of our regular agenda, and we now have the opportunity for public comment. We give 5 minutes per individual, 30 minutes total. Anybody here for public comment to the commission? Righty, nobody's running in the door. Now on to commission liaison reports. Commissioner Benega.
As I mentioned, I was at the county and township board meeting last night. It was very well attended, and I appreciate Tom and Meredith being there also, along with other staff members. Frankly, uneventful, but they all expressed their interest in some building eligibility conversations and future contracts, so to speak. I also attended the Juvenile Justice Center meeting online. I think that was last Wednesday. And again, Meredith and Jamie and Tom were there. So it's going along fine. If you drive by on the interstate, they're making a lot of progress, and they're probably going to be able to work all winter long because of the cooperative weather and the contractors staying on schedule or maybe even a little ahead. So that's all good news.
I'll just note that it was last Thursday we had our planning staff met in the city hall at Brandon for the comprehensive plan. Had about a dozen to 20 people from the Brandon area giving some feedback and getting the presentation from Scott Anderson and his team. And then this coming Thursday, that same presentation will be given at Hartford City Hall. And then I think it's this coming Monday, we have a planning commission meeting to adopt the comprehensive plan based on the feedback that we get at all those public listening sessions. So continuing to make some progress on comprehensive plan for planning and zoning. Thanks, Mr. Chair.
Thank you. Just a few things from the Human Services Department. This week is the Hunger and Homelessness Awareness Week. And so they will be hosting an event at the Human Services Building today from 1 to 5, including the Eat Well mobile market will be available. And then there's that Lunch and Learn scheduled tomorrow also, which is part of the SJC project to educate in the community.
All righty. Several of you attended the township meetings last, right?
I was unable to go also.
I thought-
Thank you,
okay.
Commissioner Benninga.
You know, Commissioner Benega went, Commissioner-elect Heisey was able to attend. I wasn't. I was visiting my brand-new grandson last night, who was born yesterday, so, and babysitting his 2-year-old brother, so, as grandparents babysit, I guess, anyway. So I would have liked to have attended that, but it's fun holding a baby that's just a couple hours old. Tomorrow morning, I have the Sioux Metro Growth Alliance Executive Board meeting, and then we have the Sioux Metro Growth Alliance monthly meeting in Valley Springs, I believe. So I will be at those meetings tomorrow. Non-action commission discussion. Anything for that? Okay. Executive session will be immediately following our commission meeting for the purposes of South Dakota Codified Law 125-2, 134, and 6. So I'll look for a motion to enter into executive session.
So moved.
Second.
Motion and a second. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. We'll enter that next door, right here. Okay. Thank you. Yeah.